Hello, ladies and gentlemen. My name is Russell Iser.
My name is Luis Bonca. We are both students enrolled in Kaiser University RTE program. We are here today to discuss a topic we both have researched extensively, which is fluoroscopy.
In this video presentation, we will be defining fluoroscopy key terms. We will be explaining the image intensifier tube, summarizing special characteristics, procedures, technical factors, and clinical applications of fluoroscopy, as well as the advantages and disadvantages of fluoroscopy.
The Food and Drug Administration FDA provides the following definition of fluoroscopy: a type of medical imaging that shows a continuous X-ray images on a monitor, much like an X-ray movie. The X-ray beam passes through the body and the image is transmitted to a monitor so that the movement of a body part, instrument, or contrast agent, like an X-ray dye, to the body can be seen in detail.
The components of the image intensifier, which is also known as the II. This all begins in a process when the X-ray tube creates photons that pass through our patient, which then again pass through and reach the first layer, which is also known as the input screen. This in green is representing our input screen, which is created by cesium iodine and allows our photons to become light photons, represented by these dots. These light photons then interact with the second layer, which is known as the photocathode. This photocathode, through a process called photoemissions, converts these light photons to electrons by a luminant surface. Next step would be layer 3, which are the electrostatic lenses. These electrostatic lenses here are negatively charged and allow our electrons to move towards the direction of number 4. Number 4 is our anode, which is represented by this blue line here, and is charged to 25,000 volts, which allows these electrons being moved past the lenses to reach our layer 5, which is known as our output screen. When our electrons arrive at the output screen, they are converted back into light photons, and at this point can be seen 3 different ways. The first way would be seen in camera. The second way would be VHS, also known as TV monitor. And the final way would be film spot. The best way to view with the highest amount of detail out of these 3 would be our Cine camera.
Fluoroscopic equipment of an operation room and how the equipment is prepared. Before we see clinical application in the operation room that is considered mobile fluoroscopy, also we can perform a stationary fluoroscopy like barium esophagus. As you could see, barium should move continually downward and into the stomach. The black is the barium. Clinical application of the knee joint. Here is the needle tip injecting contrast medium by the tibia spine. As content is being injected, we can see more detail of the flowing of the contrast media in the knee joint. This allows to show the posterior aspects of the knee, showing another abnormal condition, which is Baker 6. As you could see. Another clinical application is the cervical spine during fluoroscopy. Here is an example of a woman during fluoroscopy procedure. Look at the flexure and extension of the cervical spine looking for any trauma. Look at the quality of the image in motion without blur. Special characteristics. There are several types of fluoroscope. One is over the table, which has the X-ray tube above the table with the image intensifier underneath. The other one is under the table, which has the image intensifier above the X-ray table but below it. Also, we got the mobile CR, the mobile mini CR, and the fixed CR. Furthermore, fluoroscopes operate by full pedal with a dead man switch. It is like the kill switch of a jet ski, shutting off the fluoroscope instantly. This is an extra level of safety against unnecessary radiation exposure.
Most fluoroscopes have an adjustment process called autofluoro, which is programmed for the procedure. Once the procedure begins, it is recommended to continuously change the angle of the beam in order to spread radiation over a wider area and still maintain the target's image. Next, the radiation is carefully monitored, documented, and limited as much as possible. And finally, the radiation is measured in exposures per minute, not seconds.
I'm going to talk about the advantage of fluoroscopy. One of the advantages of fluoroscopy is that it allows the physician to see a real-time image of internal organs and structures, allowing observations of organs, their size and movement. Also images of the immediate and the ongoing movement of surgical procedures.
One of the greatest disadvantages is radiation-related risks. These include injuries such as burns to the skin and also tissue. There are slight possibilities of radiation-induced cancer occurring years later. Also, the eyes can be seriously affected by radiation, resulting in temporary or even permanent cataracts depending on the exposure. Technicians and personnel working with these fluoroscopes have a high risk and higher risk than most and need to follow safety procedures precisely every single time. In conclusion, today we first defined fluoroscopic key terms. Secondly, we explained the image intensifier. Next, we summarized the special characteristics and procedures, technical factors, and clinical applications of fluoroscopy. And finally, we explained the advantages and disadvantages of fluoroscopy. My name is Russell Isern.
My name is Luis Moncada. Thank you for your time.